Pada segmen kali ini, saya akan menjawab. Ijul Kechik bertanya berkenaan rawatan tulang belakang dan tanda-tanda penyakit tulang belakang.
The function of spine is to provide support to the human body. It is serve an axis to stabilize the human body in terms of balance. Other than that, the spine function is to protect the nerve inside the spine. And also the spine function to provide muscle attachment or limb attachment to the human body. And the next function is for well-being of the human body or for red blood cell production, which is called hematopoiesis process. The other function of spine is for calcium metabolism, which is if it is deranged, it will lead to osteoporosis. In general, the spinal column, or we call vertebral column, can be divided into multiple areas. Upper part, cervical. Second part is thoracic. Lower part, lumbar. And the lowest part is sacrum and coccyx. Cervical spine have 7 vertebrae. Thoracic have 12. Lumbar have 5. Sacrum has 5. And also coccyx have 4 or 5 fused vertebrae. As you can see in front of me, this is a spine model. This is a true imprinted 3D spine model of human anatomy for lumbar area or lower back area. Okay, and I want to show you, this is a vertebra body or bone. The white color is the bone or vertebral body. In between the vertebral body, there is a structure called disc. The disc contains 2 parts, annulus and also nucleus pulposus. The nucleus pulposus contains gelatinous material. It's a soft and delicate structure in our body. It serves as a shock absorber. The annulus is a ligament to reinforce the disc. It is to prevent the occurrence of slip disc. At the back here, there's a joint. At the back of the spine, there's a joint. You can see the joint. This is what we call facet joint. Inflammation of the facet joint can lead to pain also. And there will be a muscle over the back of the spine. This muscle serves as an anchor of the spine to maintain the posture of the patient. What we call paravertebral muscle. And you can see the next structure, which is the yellow color, is the nerve. Any problem with the spine, for example, fracture of the spine and the bone piece goes at the back, it will hit the nerve and the patient will have a pain, shooting pain down to the leg, lead to probably paralysis. Slip disc, you can see at the back here. This is the model of the slip disc. If it is slip out and pressing on the nerve, you will have a condition called sciatica. Okay, next. As you can see, there are so many causes of back pain. It can be muscle pain, spasm of the muscle, or sprain of the muscle. It also can be a slip disc, or the other term called prolapse intervertebral disc. The third cause will be degenerative disc disease. Next, spinal stenosis, or the other term is nerve compressive disorder. And the most sinister problem are, number 1, you have to identify malignancy, fractures, infection, and tuberculosis. How do we differentiate the causes of neck pain and back pain based on the patient complaint? Now, I want to bring the term called red flags. So, normally the doctor will ask history and followed by physical examination. Number 1, why we need to know the red flag sign? Because we can differentiate whether the back pain or the neck pain caused by malignancy, fractures, infection, or tuberculosis. The doctor will ask the patient if he or she has a previous malignancy, for example, lung cancer or breast cancer, and the patient have a neck pain and back pain associated with unexplained weight loss or loss of appetite, recent fever with chills, ragus, if the patient have a diabetes mellitus or immunosuppression status, or with a previous chronic disease, for example, chronic renal failure or autoimmune disease, on steroids, or if the pain occur all the time, especially during nighttime or during the rest, or recently whether the patient have a fall, or if the patient have a problem with urination or bowel dysfunction. Then the doctor will do physical examination. The doctor will assess the power of the lower limb, the sensation of the limbs. They will check the anal tone, or what does it mean? The doctor will put his finger into the patient anus to assess the sensation, perianal sensation, and also to assess the contraction or anal tone, whether there's a laxity. If presence of these red flags, then the doctor may suspect malignancy, fractures, infection, or tuberculosis. What will the doctor do next? The doctor will do investigation, blood investigation to look for the infection parameters, to look for tumor markers, and specific studies related to specific problem. Next, he or she will order X-rays and MRI of the spines to confirm the diagnosis. Again, remember, there are so many types of neck pain and back pain, but you must recognize sinister problem by remember and identifying the red flags of back pain or neck pain. Thank you. Don't forget to like, comment, share, and follow my channel. Please kindly support this channel to propagate the knowledge to other people. And don't forget to ask questions. I will try to answer the questions. Thank you.